I think we have several things that are common to a lot of communities in the United States, and that is the number of people using emergency departments for non-emergent care. Basically, they're using it as their primary care physician, and that's a very expensive way to get primary care, both for the hospital and for the patient. And we have a significant number of people with no insurance, not necessarily because they're not working, but because their work doesn't offer them insurance or they don't make enough to be able to pay insurance premiums. So there is no program or plan that they're eligible for.
It really was a community issue, the issue of the uninsured, and not one entity could solve it. So the hospital's role in the shared responsibility model is that they offer our discounted rate to our members. The return is that we put our members into a primary care home and get them out of the emergency room. We have very few things that someone can go to the emergency department for and get treated. They don't need to give you a hysterectomy. They can give you pain pills and send you on your way. What this program has done, because of the rates and the generosity of the providers, is bring it into the realm of possibility, and it has given people hope. So something that might have cost $20,000 to $50,000 in our program, all said and done, is $2,500 to $5,000.
When we sat down with Access to Health and looked at contracting, I think the piece that we all had to remember was the rates were not going to be rates that covered costs. As long as we continued to focus on this is the charity work, this is a piece of the charity work that we do, we could go to the next step in terms of moving forward with a contract. I believe strongly that it's been a good thing in the Reno area, primarily because doctors have come to the table, hospitals have come to the table, and the patients have come to the table. And we all have to give something. They now have access to primary care earlier, and I believe frequently don't have to go to the ER as their primary care home.